the coronavirus pandemic sweeping its way here into the state of Ohio, of course, the health and safety of all of our American lives are at the forefront of our minds. So we've got a medical professional with us, the VP of Medical Affairs over at OhioHealth, Dr. Gavin Baumgardner. Thank you so much for joining us today, sir.
It's my pleasure. Thank you very much for having me, Don and Brian.
Do you feel like OhioHealth was properly ready for an outbreak like this to handle some of the patients that I'm sure you guys are dealing with right now?
Sure, I think it's a great question. So, I think it's tough for any organization to say that they're fully prepared right out of the box to deal with a pandemic like this. Now, that being said, we feel really comfortable with our emergency preparedness. We have a pretty comprehensive plan, both locally and within our system. We have really close collaboration with our system emergency resources, as well as local and then regional resources. So we happen to be part of the Northeast Central Ohio Regional Healthcare Coalition, which really helps with disaster planning and emergency preparedness for our region of the state.
To piggyback off of that, ultimately, who is responsible for making sure that a plan is in place? And are you guys practicing emergency relief scenarios on a regular basis out there?
We do some disaster scenarios on a pretty regular basis, several times a year, that range from natural disasters to mass casualties. So we exercise those both here locally and then coordinate regionally within NECO.
Doctor, can you describe the capacity at OhioHealth? Are you at risk of a ventilator shortage? And can you speak on how much resources do you have? How many ICU beds do you have? How many nurses and doctors are available to treat COVID-19?
So what I can tell you is that normally on most given days, we have 30 critical care beds within our facility. Now, that being said, we realize that with COVID-19, the primary concern is for the overwhelming influx of critical care patients that many of the hospitals that you're seeing both around the world and nationally are dealing with. So we've actually started to develop a plan and are fine-tuning that, both with expanding critical care beds within our hospital, making sure we have accounting of all of our ventilators and supplies, because it's more than just ventilators, and then making sure that we have enough people, so staff, nurses, other technicians, as well as physicians and advanced practice providers to help staff those beds. So we have a really comprehensive plan right now to expand capacity pretty quickly. And we're also then working regionally within NECO and within our system to make sure that within our hospitals, we can expand capacity pretty quickly.
What about test kits? How many do you currently have right now, and where do people go to get a COVID-19 test kit?
So again, another really good question. We're getting a lot of those from our local providers right now, a lot of questions about that. So we started out using primarily the Ohio Department of Health lab. That's how many of us started out. And that was a couple weeks ago. We've now evolved to be able to expand to send to outside labs, which are called reference labs, to get COVID testing. And now we have the ability to do testing within our own hospital labs, which is the good news for us and for the public is that our turnaround time with each of those steps along the way has really improved quite a bit to where now our turnaround time is under 48 hours on our testing kits. Now, your other question was really around where can folks go to get tests? And so one of the things we're quite proud of is that here locally in Richland County, we were able to stand up an ambulatory testing facility. This is actually a drive-through facility like you've seen probably on the news in many areas of the country, where a family physician or primary care physician can call ahead to a hotline that we've set up 24/7. They can talk to somebody about the patient that they have concerns about. And if they go through the screening criteria, we can approve that test. The physician enters the order, and then the patient will then drive through our ambulatory testing facility, get the test done, and then 48 to 72 hours later, get the results back. So we're quite happy that we've been able to fill that need for our community here locally.
If Central and North Central Ohio were to experience a situation as we are now seeing in New York City, is OhioHealth prepared to expand your facilities to treat people who are not experiencing COVID-19 symptoms?
So both in our hospitals, both Mansfield and Shelby Hospital, we've looked at their way to expand our medical and surgical beds to take care of both COVID and non-COVID patients. And then I think part of the question too is around what can we do in the ER? What would happen if we were to be overwhelmed with a large number of patients coming in with symptoms, with more significant symptoms? And actually starting today, I think that the tents were probably just dropped off today, but we've developed a plan for how we're going to set up triage tents right outside of our ER, and a process that's already been kind of honed at one of our sister hospitals within OhioHealth. They already have the triage tent set up to kind of work out the process for how we would handle that. So we actually already have a plan and the tents on site for Mansfield, and we would roll out those same triage tents for freestanding emergency department in Ontario, as well as our hospital in Shelby.
What can you tell us about the number of patients that are coming in to get treated for COVID-19 right now? Like, what is the percentage in terms of people that are coming in for what you might call a regular medical procedure versus just a coronavirus patient?
Yeah, I think because of what you've seen in the national news and all the attention that's been paid to COVID-19 right now, we do see that the volume of patients coming in for non-COVID related issues has actually dropped in our ERs. In addition, we've followed the governor's mandate that we should stop doing elective surgeries and procedures. So that's actually significantly decreased the number of patients coming into our hospitals on a regular basis. So I think between both the news and the decreased ER visits, as well as decreased elective cases and procedures, heart and vascular imaging, other types of surgical procedures, we've seen quite a drop off in volumes in our hospital that are non-COVID related, which is a good thing. It decreases their exposure to an environment that has COVID patients. And it helps us kind of readjust our resources to make sure we can respond to a surge potentially in patients.
But a surge has not yet happened here in Richland County, or specifically Mansfield yet, right? You guys have not felt overwhelmed by a number of patients at this point?
No. So we've definitely not felt that overwhelming surge. There is some good data from the governor's office and from working with Ohio State and some analytics folks and mathematicians on looking at modeling for when that surge might happen. And we certainly, based on the models, expect that over the next month to start to ramp up based on what we're seeing nationally and locally here.
Here in Mansfield, Richland County, we don't have big city living. We're a small to medium-sized region here. Now, in terms of community spread, should people be wearing gloves when they're pumping gas? Should they wear gloves at the grocery store? Should we be wearing masks right now?
So what I'd say is, even though we're not in a major metropolitan area like New York City with mass transit, we still want to maintain those same basic precautions. And here's what I would kind of remind people, and I may have another opportunity to remind later on too, is I would make sure that we are seeking out reputable sites when it comes to getting good information about coronavirus and COVID-19. So I really point people to the cdc.gov site, the ODH coronavirus site, and then OhioHealth has a blog or a newsroom where we post a lot of our articles. I think it's newsroom.ohiohealth.com, where we post a lot of good information. So that being said, the same precautions are in place here, which are great hand washing. So to carry around, I have a little handheld or a pocket-sized hand sanitizer. I have them all over my office and at home. It's great hand washing, at least 20 seconds of hand washing. It's social distancing. It's staying home. It's making sure that we kind of maintain those normal precautions. Masks are a tough question, and a lot of people ask about those. Right now in the hospital, our frontline staff have the option of wearing masks for all of their encounters, and we're finding some do that and some take a pass on using the masks right now. Out in the community, we're not advocating wearing gloves. What we do say, and if you look at the CDC site, it does say that if you are sick or exhibiting symptoms and you absolutely have to leave the house, you probably should wear a mask. And so those are the cases where we're recommending, based on the CDC guidelines, to go ahead and wear a mask. But for the general public walking around, the masks are probably not going to be particularly helpful right now. But again, I would keep an eye on those CDC and ODH sites, because I think they give the public and healthcare professionals really good advice.
Doctor, are you feeling hopeful with the release of information from the governor's office yesterday in terms of the reusing of masks?
Yeah, so we're actually very hopeful. So you may have caught in the press conference that he mentioned OhioHealth had actually been part of the pilot with Battelle for that. So we've actually been working on that reprocessing process for a couple of weeks now. So we at Mansfield have actually been sending our masks down to Battelle for the last couple of weeks. And I think we're just getting ready to see our first shipment back on that. So we were luckily a little bit ahead of the curve. We were one of the pilot sites within the state here at Mansfield to do that reprocessing. So really encouraged by that, starting to expand that. So I think it's going to be a great thing to help kind of preserve and conserve a really valuable resource for our frontline healthcare personnel.
And just a quick follow-up, when did you send those masks in, and when are you getting them back again? How long does it take?
Oh, so I think we've sent them in over the past week to week and a half. Takes a little bit of time for the reprocessing, and I think we expect to get them back this week, our first shipment back. But we've been part of that pilot project. Some of our other sister hospitals were part of the original. I think we were the third site within the system to do that work.
In terms of just working with the government and other agencies, how would you rate this process so far? Obviously, it's unprecedented. You haven't had to deal with anything like this. I know that Ohio and certainly our governor has been getting a lot of praise for being ahead of, a lot of the moves that he has made. How has it been as working in the healthcare industry, working with the government? How's that process gone?
Well, I think you're exactly right, Brian, in saying that this is unprecedented because I've been in practice 20 years and I've not experienced anything like this before. As a system, we feel really good about the collaboration. As a system, and then locally here within Mansfield, we've been in touch with the governor's office on the phone calls with Ohio Department of Health, Ohio Hospital Association to participate in local, regional, and state planning. So we feel really good about where we are right now within that. So while we don't have every detail of the plan finely tuned right now, we're working daily to try to improve that in our status.
Can you take us through the process of someone who is diagnosed with COVID-19? What happens? Are they allowed visitors? How long does it take to treat?
First and foremost, actually, the vast majority of people who are diagnosed with COVID-19 end up going home. So we know based on national and international stats that about 80% or more of those have pretty mild symptoms and don't need hospitalization. Now, for those that need hospitalization, typically they come in through our emergency rooms. When we identify somebody with potential COVID symptoms, we put them in a room, we put a mask on, and our staff takes precautions, we get them tested. If they then need to be hospitalized, we take them upstairs onto one of our units. And what we've done is, much like the rest of the country, we've actually taken the CDC's recommendation that we have what are called cohorted units. So units where we have special protective equipment, staff is particularly trained up on how to use that equipment and care for these patients. And so we have a couple of units in our hospital right now where we have most of those patients. One of your questions was also around visitors, and unfortunately, again, based on state and federal recommendations, we've gone to a no visitor policy. And that's incredibly, incredibly difficult for our patients in our community. We completely understand that, but this is really with the patients and the family's best interest, as well as our associates' best interest at heart, to take what's really a massive step when you limit visitation on some of our sickest patients, and I completely understand that. There are exceptions, and so some of those exceptions might include deliveries. So women who come in who are going to have babies, there are exceptions for visitors there. End of life. So unfortunately, when patients near end of life and need to have family close, we do make exceptions for that. So that we do follow kind of the federal standards around visitation limitations and make sure that we're following those exceptions.
Well, with the stay-at-home order, have you taken up any new hobbies, any new activities in your life right now?
You know what? It's interesting. I think I have kids, school-age kids, so I always say there's a few good things that come out of difficult and challenging situations like this. And one is that we all start to reconnect with our families in a different way. So a lot more board games. I actually pulled out a jigsaw puzzle for my 11-year-old the other day who had I don't think she'd ever seen a jigsaw puzzle in her life. And I said, we're going to put this together. And she said, why would I do that? And I said, because it's fun, let's give it a shot. But no, I think those reconnections with each other are going to be really important for us to make it through a time like this. It is unprecedented, as you mentioned before, but I know, I think the hashtag is we're in it together, Ohio. We're definitely in it together, and it's not just OhioHealth, Mansfield, or Shelby. This is something that we as a people can really beat this challenge. So how about you guys? Have you picked up any hobbies?
Wow, good follow-up question.
Now I also have school-age kids, so now I'm an educator at home. I'm learning to redo my arithmetics, so it's been fun to see what it was like to be a fifth grader all over again. That's been an interesting hobby of mine. I almost never had time to sit down and watch full movies or shows, so I'm diving into the Netflix right now and spending a lot of time watching TV. What about you, Donnie?
I'm honing in on my cooking skills. I made a fantastic batch of cookies last night.
Ooh.
And you know what? I'm just enjoying the time.
Yeah, no, it's great. No, my girls are way into baking right now. We've made 2 batches of cookies, probably put on. Hopefully we don't call it COVID-19 for putting them during this pandemic. So.
Well, one thing is for sure, I think this enemy that we're all fighting, that is kind of bringing community together. So we certainly appreciate everything that OhioHealth and the nurses and the doctors are doing for us out on the front line. So Dr. Gavin Baumgardner, thank you so much for joining us today.
My pleasure. Thank you very much for the opportunity, Brian and Don. Thanks.
All right, Donnie, so it sounds like OhioHealth right here in Mansfield having a lot of coordination with the governor's office, and they've also been at the forefront of the pilot program with Battelle. So sounds like we have some top dogs right here in Richland County.
Absolutely. I love the fact that Mansfield is coordinating with the governor, with private industry to get things done, because this is a state of emergency. We need to move fast so that we can help the people here.
And it sounds like obviously there's going to be lots of testing provided right here in Richland County, that they're ahead of the curve, that they haven't had a full influx. So it sounds like OhioHealth feels like they will be ready if and when we were to have a big surge.
Absolutely. Excited to hear that.